Now keep apart your legs as far as possible. As far as possible. In the beginning, one is not able to develop as efficiently as Mr. Singh is developing. Now hold both the big toes with both your hands slowly and bend forward. Place both your hands on the ground, your forehead on the ground, your chest on the ground. But one should develop this asana according to one's capacity and according to one's elasticity. This is extremely beneficial for dances as it gives elasticity to all the joints. Now leave this asana. Keep the upper portion of your body straight. In the same position, he will develop Gorakshasana. There was a great yogi by the name Gorakshnath. Bending both the legs from the knees, bring both the soles together, heels together, sole together, toes together. Now place both your hands on the ground and from behind, lift your body and place the perineum on the heel. Both your hands on the knees in Gyan Mudra. The body straight. That means spine and head straight. Just look at this asana from the back also. Mr. Singh, please develop this asana from the back and see the position of the heels. Is bend both the legs from the knees. Now see the position of the heels. The spine is straight. It's extremely good for those who are suffering from ankle pain, aching knees, and also good for celibacy, Brahmachari. Now leave this asana, Mr. Singh, and lie down on the abdomen for doing Makrasana, the crocodile posture. The crocodile posture, this asana is for relaxation, and this is very good for abdominal breathing. And abdominal breathing is good for those who are suffering from lungs disorders. Look at his hands. One hand is over the other hand. Like this. And look at his feet also. The toes, big toes. All the toes are flat on the ground. Heels and toes are together. He is simply lying. It is a very much a relaxed asana. The yogic text says the anger comes down. Now he will develop Naukasana. Fold your hands. Look at his hands. Fold your hands, Mr. Singh. Intercross your thumb. Stretch your arms forward. Start lifting the arms from the ground slowly, along with your head, chest, and now lift your legs also, so that the entire weight of the body is concentrated on the navel region. The boat pose, very good for the spinal problem, for the constipation, for indigestion, and for the obese people. Now please come down slowly from the Naukasana. This is another way of relaxation. You can relax in this asana also. Now Mr. Singh will develop Bhujangasana. Place both your hands just beneath your shoulders. Like this, all the fingers together. Forehead on the ground or chin on the ground. Now start lifting your head chest, upper portion of your body. This is one type of Bhujangasana. Look at his leg, that is totally together. You should not bend your legs in any way in this Bhujangasana. This is the first type of the Bhujangasana. Now see the second one, in which he is bringing the elbows straight and bending the body from the lower spine. Very good posture for constipation, for indigestion, for the lower spinal problem, for sciatica. Now come down slowly. You can retain every posture for 15 to 20 seconds. Keep your breathing normal. That means abdominal breathing in all the asanas. Now he will develop the Ostrasana, the camel pose. This is another way of doing the camel pose. Bend both your legs from the knees. Keep your knees apart. Hold the ankles with both your hands. Hold the ankle of the right leg with your right hand, left with your left hand. Now start lifting your body from backward as well as forward in a very balanced way. This is Ostrasana, a very perfected posture, but you should develop it gradually and slowly. Now please come down. Mr. Singh, I think, show it while facing to the camera, because viewers have a right view of this Ostrasana. See how he develops the Ostrasana. That is again good for all the abdominal ailments, for the spinal problem. It develops the muscles. Now look at him. He's holding both the ankles, lifting it as much as possible and retaining it. But breathing is normal. That means you are breathing in through the nostrils slowly, breathing out through the nostril. Now please come down and lie down on your back for Chakrasana. First show this asana while lying down and then in a standing position. Keep your both the legs straight in this lying down position. Then bend both your legs from the knees like this at a distance of 1.5 feet. Now bring both your arms just under your shoulders like this. The right arm under the right shoulder, the left one under the left shoulder. Now start lifting your entire body on both your legs and both your hands. Keep your head in a hanging position. This is known as Chakrasana, the wheel posture. It is said that all the endocrine glands are stimulated. One can keep oneself physically and mentally healthy by developing this asana every day. Good for the diabetes, good for the spine. Please come down slowly. Now he will perform this asana in a standing position also. See the same Chakrasana in a standing position. After you get perfection, elasticity in the spine. Now stand in this way. Your feet is 1.5 feet apart. Now the whole body, he would bend both the knees, lifting the arms upward slowly and bending the body from the waist backward slowly, bending and placing both your hands on the ground. This is also the chakrasana one can develop. Now please come back while standing as well. Like this one can come back. Now lie down again for doing Uttan Padasana. The legs stretched asana. Good for the abdominal problem and also the abdominal muscles. Now lift both your legs at an angle of 30 degrees from the ground. Your hands just far away from your thighs, little far away from your thighs. Your head is also lifted up from the ground. You are looking at the big toes. Look at the big toes, they are stretched. Please come down slowly. After every asana, you should relax. You should not exert much in the practice of the asanas. Now Supta Pavanmuktasana with right leg. Bend the right leg from the knee and place it on the abdomen. Hold it with both your hands. Press the abdomen. Now lift the other leg at an angle of 30 degrees and also your head. Now again see the stretched position of the toes. Both the toes are stretched backward. See the position of the head. Forehead is touching the knee. Now please come down and develop the same asana with your left leg. This asana is good for the elasticity of the lower spine, for the flatulence problem, and also for the obese people. These are the alternate positions of the Supta Pavanmuktasana. Now please come down. He will develop the full Pavanmuktasana. Gas, release posture. Both the legs are bent from the knee. Place it on your chest. Hold both the knees with both your hands. Force it. And now stretch your toes. In every asana, stability is must. But if you are fat enough, if you have an obesity, you can roll down in this asana. Like this. This helps in burning the fat of your body and also releases the excess wind. Now leave this asana and lie down on the ground for doing Urdhva Sarvangasana. Urdhva Sarvangasana, look at his both the legs. Hands are down, facing towards the earth. Now start lifting both your legs slowly, 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 and lift your hips also, your spine also. Place both your hands on the waist. But while lifting the legs, you have not to lift the head. The whole body, that means the shoulders, the hips, and the legs are in a straight line. The toes are stretched upward. Hold it. You can retain this posture again for 15 to 30 seconds in the beginning. Those who are suffering from high blood pressure, heart problem, they should not perform this asana. Now from the same asana, Mr. Singh will develop halasana. Bend both your legs downward towards your head. Place both your big toes on the ground and both your arms behind your back. Now please come down. Look at him how he is coming down. You have to slowly come down without lifting your head from the ground. This is essential. These asanas should not be developed by those who are suffering from the spinal problems like cervical or sciatica problem or lumbar spondylitis. He is relaxing in Shavasana. Now please open your eyes and sit down in Padmasana for doing pranayama practices. If one is not able to develop Padmasana, one can practice these pranayama in Vajrasana also. The Bhastrika. Place both your hands on your knees. You have to breathe out forcibly, breathe in forcibly through both your nostrils. While breathing in forcibly, the abdomen expands. Breathing out forcibly, the abdomen contracts. Look at his abdomen and the nostrils. At least you can practice it about 15 to 25 rounds. And this Bhastrika can be practiced for 2 or 3 times for getting relief from the cough, sinusitis. This is also known as Kapalbhati. This cures headache. Look at his abdominal movement. Breathing in, abdomen out. Breathing out, abdomen in. Now, Mr. Singh, leave this practice. We will practice one simple pranayama, that is Nari Shodhan pranayama. Nari Shodhan pranayama. Look at his left hand that is placed in Anjali Mudra at the navel region. At the navel region, look at his hand. Now, from the right hand, both middle fingers are placed on the left nostril. The thumb is placed on the right nostril. Be sure your spine is straight, your head is straight. Now, both the nostrils are closed at this time. Now open the right nostril. This one can open the right nostril. Now place the thumb on the right nostril. Now release the left nostril. In this way one can open and close the right or the left nostril. Now from the left nostril, breathe in slowly. Slowly breathing in. Now close the left nostril. Bend your head down, place both your hands in Anjali Mudra. Now retain the breath. He is holding the breath inside. Now again bring your right hand on the nostril. Now open the right nostril, breathe out slowly through the right nostril and contract the abdomen. Now breathe in again through the right nostril. Close the right nostril. Bend your head forward. And retain the breath. Again, bring your right hand on both the nostrils. Pressing both the nostrils, release the left nostril and breathe out through the left nostril. Do one more round of this Nari Shodhan pranayama. This completes one round. While breathing in, you can count mentally 20. While breathing, while retaining the breath, you can count 40. And while breathing out, you can count mentally the 40. That will help you in fixing the duration of inhalation, retention and exhalation. The actual ratio in pranayama, inhalation is 1, retention is 4 and exhalation is 2. But in the beginning, you can maintain the ratio of inhalation, retention and exhalation 1:2:2. You should practice this pranayama at least 5 rounds daily in the beginning. This is a simple way of practicing pranayama. It is a difficult subject. There are many things to be understood before the practice of pranayama. It should be learned under the supervision of an expert teacher because it involves many bandhas to be developed at the time of practicing pranayama. That can only be experienced. After the practice of yogasana, pranayama and isometric exercises, one must relax in shavasana as Mr. Singh is relaxing. See his body, the head. His eyes are closed gently. It is not forcible closing. It is gentle closing of the eyes. Lips are touching each other. Look at his hands. The palms are facing upward. Look at his legs. He is little far away from the thighs and toes lying on the sides. In Shavasana, the instruction of an expert teacher is essential. You can also practice. The first thing is that keep your body completely loose, feel easy and comfortable like a corpse body. You see the corpse, it doesn't move. So, you should not move any part of the body for at least 15 to 20 minutes of this relaxation asana. After you feel easy and comfortable, you bring your mind to the right side of the body. When I would name the different part of the body, you have to feel it. Visualize that part simply. Feel the right hand thumb, second finger, third, fourth, fifth. Palm of the hand, back of the hand. Upper, lower arm, elbow, upper arm, shoulder, waist, right thigh, knee, calf muscle, ankle, heel, sole, top of the foot, right big toe, second, third, fourth, fifth. Again bring your mind to the left hand thumb. Visualize the left hand thumb, second finger, third, fourth, fifth. Palm of the hand, back of the hand, wrist, lower arm, elbow, upper arm, shoulder, waist, left thigh, knee, calf muscle, ankle, heel, sole, top of the foot, left big toe, second, third, fourth, fifth. Now bring your mind to the back of your body. Visualize the back of your head. Right shoulder blade, left shoulder blade, whole spine, right hip, left hip, back of the right thigh, back of the left thigh, back of the right knee, back of the left knee, right calf muscle, left calf muscle, right heel, left heel. Now bring your mind again to the top of the head. Visualize the top of the head, forehead, right eyebrow, right eye, left eye, right ear, right cheek, right nostril, upper lip, lower lip, chin, jaw, throat, right collarbone, left collarbone, right side of the chest, left side of the chest, navel, upper abdomen, lower abdomen, right thigh, left thigh, right knee, left knee, right toes, left toes. Now visualize the whole of the right arm, whole of the left arm, both arms together, the whole of your right leg, the whole of your left leg, both legs together, the whole body together, the whole body together. After revolving your mind to the entire body parts, bring your mind to the navel and visualize the breathing process. Visualize the breathing process, watch the breathing in and breathing out process. At least for another 5 to 10 minutes, you can count the breathing also, so that the mind remains inside the body and your body and mind are totally relaxed. But a caution is again that you should learn all these aspects by an expert yoga teacher. After relaxing in Shavasana, move your fingers of the right hand little. Move your fingers of the left hand little. Place both your hands on the eyes. Bring both your hands on the eyes slowly. And then open your eyes and sit down. This completes our session of yoga practice. So this ends the practice of 1 hour duration of the asanas, pranayama and some isometric exercises by which one can keep oneself healthy physically and mentally. In fact, therefore, there are 84 lakhs of asanas as explained in the yoga texts. Now Mr. Bal Mukund Singh will show some typical and unique asanas which he has been practicing for many long years. He will perform the Purna Chakrasana first. Look at him and his elasticity and perfection he has. Purna Chakrasana. These are extremely difficult postures. One must learn under the supervision of an expert. Now, he will demonstrate Nataraj Asana. All these asanas are typical and difficult asanas. Nataraj Asana. Balancing is rather difficult. but by practice it comes. Now he will perform Vrishchik Asana. The first Vrishchik Asana, there are two parts, two types of Vrishchik Asana. See the perfection he has in developing the Vrishchik Asana. And the B, second type of the Vrishchik Asana, he will develop now. The balance, the perfect balance he has. Another Vrishchik Asana. That's marvelous. Coming down slowly, having a perfect balance. Now he'll perform Merudandasana. Merudandasana. Merudand simply means the spine. It has to do with the spine. The yogic text explains that all the 72,000 nadis that we have in our body, especially in the pranamaya kosh, all are purified by the practice of this Merudandasana. So the Vrishchik Asana is this. Now he will develop Dvipad. Prior to that, it is Supta Vrishchik Asana. He will develop. Hatha Yoga is a one school of thought which emphasizes on the perfection of the body. And through the perfection of the body, the perfection of the mind comes. It is a Supta Vrishchik Asana that he is going to develop. It requires a lot of concentration, rhythmic movement, slow and gradual movement of the muscles, of the spine, of the joints, in developing these typical asanas. Now, coming to Dvipadhastasana. Dvipadhastasana from both the, he will first develop from one side and then other side. It appears there is no spine at all, the elasticity of the spine. From the other side, he will demonstrate Dvipadhastasana. He will demonstrate the Dvipadhastasana is now apart from the elasticity that comes by the long and regular, arduous practice, now he will demonstrate Purna Dhanurasana. Difficult and typical postures does not only require a concentration but also the gradual and the slow movement of the body, its joints. Yes, Purna Dhanurasana. Now he'll develop Ardha Urdhvasana. Ardha Urdhvasana. Mr. Singh, Bal Mukund Singh, an expert in this culture, went to Russia to demonstrate the asanas, the Indian festival in Russia. Now he will demonstrate Ekpad Kandrasana. Ekpad Kandrasana. Mr. Bal Mukund Singh has been the champion of the Yogasana many a times. Ekpad Kandrasana. Now he will demonstrate Dvipad Kandrasana. Now he is guiding and inspiring particular students in the Institute who want perfection in the physical aspect of yoga, especially the Yogasana. Now he is developing Dvipad Kandrasana. again the most typical and unique asana. This is Dvipat Kandrasana. Now, Utthit Dvipat Kandrasana. It is Utthit Dvipat Kandrasana. The entire body has been lifted on both the hands. Now, please come down. Show. Now, the demonstration of Vikat Asana. Vikat simply means the strength. Of course, the body becomes or turns into a strange shape. From one side, he is developing Vikat Asana. From the other side, he is developing Vikat Asana. And now, Mrigasana, the deer posture. The yogic text explains that by the practice of this asana, one attains lightness in the body. From the other side, the Mrigasana. Now, the last asana is Ek Hath Mayurasana. The entire weight of the body is lifted on the one hand horizontally. Mayurasana is known. Mayur simply means peacock. The Mayurasana, the entire weight of the body has been lifted on one arm only. That's all. Thank you. All the typical asanas. Thank you for viewing.
Thank you for Vijay.